Wyss Wellness Center was really created to provide a medical home for the larger refugee and immigrant community that lives in South Philadelphia. Many of them do not have great access to care, in particular primary care. So we wanted to have a medical home where they could get, really comprehensive primary care services. In addition, we wanted to be able to have, embedded social services available to really address the social determinants of health and, work collaboratively with our partners to improve the general wellness of this community. I've been fortunate enough to be working with the refugee and immigrant community since 2007. And I will admit, when I first started, I was very unfamiliar with the refugee program and what individuals went through in other parts of the world. All you have to do is listen to a couple of these stories of what some of these individuals have faced. Refugees by definition are someone who has been persecuted for a number of reasons. And many of them have lived through years and years of atrocities, been exposed to violence and torture, which has truly been inhumane. And when there's individuals who are fortunate enough to make it to this country, I am their biggest advocate and a very strong believer that this is my community and these are the people that we need to serve. When I took the Hippocratic Oath as a new physician to provide care to others, this is why I did it. My goal was always to take care of the most vulnerable patients in my community and do whatever I could possibly do to advocate for them. And, my focus right now is on the refugee and immigrant community. Well, it's been my focus for 14 years, but this is my community. This is what makes our country great. This is why Philadelphia is a great melting pot of a city. And this is my community here. And we need to do whatever we can possibly do to provide the care that they deserve.
So I've been a resident at Jefferson for 3 years. I worked in the refugee clinic in Jefferson, and that's sort of where I got my first exposure to the refugee healthcare. I've also worked at taking care of Latino patients in Philadelphia at another clinic, and that's where I worked with mostly immigrant patients. I can think of a particular case I saw recently actually here for an uninsured patient who was a refugee and had a new diagnosis of an advanced cancer. So we were able to get her an appointment. She was discharged from the hospital where she found out she had cancer. We were able to get her a new patient appointment here because someone had referred her from Jefferson, which was great. And we talked to her, made sure that she understood her diagnosis, hooked her up with one of our community health workers who was able to make sure that she was able to get to her follow-up appointment with that provider. And we'll be following up with her in a couple of weeks. So that was a very cool experience for me because there were a lot of barriers. So language barrier, she was uninsured, and then transportation, she needed transport to her appointments. And then the fact that she was a new diagnosis of cancer was also obviously challenging. It's important to us to sort of be in the community where our patients live, and that increases patient access. It makes our know our patients better because we're right within the area that they live in. Patients can literally walk in and make an appointment. That helps with access and then just helps with continuity of care too. So some of the patients we'll be seeing will be discharged from Methodist Hospital. They'll be able to have a follow-up appointment arranged then, and they'll be able to come to the clinic, which is close to where they live. We do know also for our immigrant and refugee population that transportation can be an issue. So having it be in the community where people are living, not having to take a bus or a train or drive a car to get here is really a great part of this clinic being where it is.
The opening of the Wyss Wellness Center is the realization of a lifelong dream for me and Dr. Altschuler, and that is to bring high quality whole body health care to a community that has largely been ignored and neglected by, systemically and institutionally. I think the Hansjörg Wyss Wellness Center will fill an incredible need that has been neglected for many, many years. And I think, as you know, the Wyss Wellness Center will be the first immigrant-focused wellness center in the state of Pennsylvania. I'm a refugee, Vietnamese refugee who came to the United States as a child. Growing up in the same neighborhood, in fact, I still live, I moved back there about a decade ago, So I live about 3.5 blocks from the Wyss Wellness Center. This is, again, I said, a lifelong dream for me to be able to bring, this type of service, this type of high quality healthcare to the community that I've been committed to serving lifelong. So I think, the partnership with Jefferson is incredible. And the gift from Hansjörg Wyss could not be more timely, especially coming off or still in the midst of the pandemic, when a lot of high quality healthcare is literally inaccessible to this community. Opening up the Wyss Wellness Center is just a dream.
This is the Wyss Wellness Center. Soon, artists will begin work on a mural at the entrance proclaiming welcome in many different languages. This mural will represent our mission here to welcome and serve the immigrant and refugee population of our city. This new facility at the Bach Building in the heart of South Philadelphia is home to medical and support services, social services, and a community space, all designed to provide for the needs of the underserved in our region. The medical services area is comprised of 12 exam rooms with separate private consultation spaces. Here, we offer a full spectrum of primary care for all ages, as well as women's health, prenatal, and OBGYN care. And it is all provided regardless of health insurance or citizenship status. Basic medical tests can be performed on site, and imaging tests are done at nearby Methodist Hospital. Looking ahead, our goal is to add dental services as soon as we can obtain funding for the necessary equipment needed. Our social services component is provided by SEAMAAC, one of the oldest and largest refugee-founded social service agencies in the region. Those who might need social services can relax in a comfortable waiting space before meeting with a social worker in a private room. Some of the services offered include domestic violence assistance, elder health and wellness aid, ESL and literacy programs, and employment help. At the Wyss Wellness Center, our community space was created to bring people together. Starting with a tranquil garden at the main entrance and continuing on to the Roberts Community Learning Center, the area can be used for celebrations, wellness activities, art therapy, educational programming, and so much more. The hallway from the waiting room to the Learning Center will soon be lined with art, creating a gallery for all to enjoy. Philadelphia is a city steeped in history, and the center has preserved a bit of its past. A section of the old school's building's original flooring, which runs through the center of our facility. Here at the Wyss Wellness Center, we speak many languages, but mostly we speak the language of compassion, caring, and healing. The goal of this new complex is to reduce health disparity gaps among refugees and immigrants, and in doing so, significantly improving their lives.
I think the healthcare system is so complex and challenging enough for people to navigate. I think for immigrants and refugees, it can really prove to be insurmountable. I think language and cultural barriers are two of the most major obstacles that I think to care for these folks properly, we have to create a friendly and welcoming environment to really deliver culturally competent care. People don't want the same out of the healthcare system, right? And I think people want to be in control of their choices, their options. And if you ask people what wellness means to them, chances are you'll get some differences in that response. So I think importantly, trying to understand what is most important to individuals. And a lot of that we know is shaped by different cultural beliefs. So I think to the degree that we can take that into account when we're trying to meet the needs, and things like interpreter services and those things, those are the obvious, but there's a tremendous amount of detail that would go in to really trying to meet the needs of all the different populations that exist. I'm extremely grateful for the support of the Wyss Foundation to bring this to fruition. And it really allows the work that Jefferson has done for many years in this space successfully to further expand into the South Philadelphia community where it's so needed.
Well, one of the advantages of being part of a large health system is that you're able to have multiple access points that are close to where people work, live, and play. The barriers that people might experience of getting from one place to another, that's removed. And additionally, the fact that they're co-located will allow both organizations to grow, to be able to learn from one another so that we can, over time, adapt our programming to be even more seamless. This is a new lovely center that's representative of, it's a culmination of the passion and commitment of the community, as well as Jefferson and our philanthropic partner in Mr. Wyss and others, to really fill a need that has been there for some time. And it's going to be growing and evolving, but it will do that in collaboration with the community. And it is important that the center be reflective of and serve the needs of the community. And so to that, we know we need to be a trusted neighbor.
I so clearly remember the first time I saw Field of Dreams, and it's become one of my all-time favorites. And in the world of philanthropy, it also applies. If you build it, they will come. And we were able to fulfill the dream of Dr. Mark Altschuler to create the Wyss Wellness Center. I'm at the Wellness Center now and had the enormous pleasure of meeting Mr. Wyss today and being with him as we toured the facility that bears his name. And how extraordinary to take a dream and make it a reality. And the only way we made this dream a reality was through the generosity of our benefactors, through people believing in this dream and wanting Jefferson and our partner SEAMAAC to make this dream a reality. And I just want to say how deeply I appreciate your confidence in us, your generosity, and your faith in the future. When we conceived of this wellness center, it's quite a different political environment. And today we're talking about how many refugees and how many immigrants we are going to be able to welcome this fall into this magnificent new facility. So thank you for dreaming with us. Thank you for having the faith and the hope and the belief in us. And on behalf of Dr. Altschuler, on behalf of SEAMAAC, on behalf of the countless families that we're going to be able to help for so many generations, thank you.
In my nearly 8 years at Jefferson, this is one of the most exciting and most meaningful moments I've been a part of. During that time, Jefferson has made great strides. But what we do isn't about Jefferson. It's about our patients. It's about our neighbors. And it's about our city. When I leave this job, I want to be able to say that Jefferson made a difference in Philadelphia. That's how we'll know we're fulfilling our mission of improving lives. You know, we often say the coronavirus pandemic has thrust us into, quote, unprecedented times, unquote. In a way, that's right. Those of us working on the front lines of healthcare see how COVID-19 has ravaged the lives of individuals and families. But for those who study community healthcare trends, the pandemic hasn't taught us anything new. It's actually confirmed, tragically, what we already knew. If you were to ask us what is the biggest factor that increases your chance of being hospitalized with or dying from COVID-19, it wouldn't be whether you wore a mask or practiced social distancing. Those are important for sure, but they're not the biggest risk. It's not something hereditary written into your genetic code either. It's your zip code, the neighborhood you live in. Zip code is the #1 indicator of the health and well-being of individuals. Before the pandemic, we knew that the social determinants are a huge predictor of health. The coronavirus is drawing a big, bright line under the fact that good versus poor health is as much a social issue as it is a medical one. Healthcare isn't just about what we do in the clinic. It's about what we do in the streets. That's why I'm so excited about today's grand opening of the Hansjörg Wyss Wellness Center. South Philly, especially with its large population of refugees and immigrants, is one of the places in our city where health inequity looms large. Dr. Mark Altschuler and the Jefferson Center for Refugee Health have long provided healthcare services to this very vulnerable community. But the Wyss Wellness Center takes it to a much higher level. The reason is simple. It's partnerships. Jefferson and the Southeast Asian Mutual Assistance Association coalition makes the center a real collaboration. Together, Jefferson and SEAMAAC can take on the social determinants of health by providing the full range of needed services. Partnerships are an important way that Jefferson is making a difference in Philadelphia. Partnerships with private, municipal, and neighborhood organizations are a big part of what Jefferson is doing all over our city through the Philadelphia Collaborative for Health Equity. Another difference-making collaboration is our philanthropic partnerships with compassionate and visionary benefactors like Hansjörg Wyss. His generosity and the contributions of our major donors are absolutely vital to the broad collaboration of partners working together to close the health equity gap in our city. Those partnerships make us better together, and they make all the difference.
I'm a Jefferson alum, and I graduated several years ago, and I am now in the capacity of having conversations with Dr. Altschuler. And I myself have had the experience of having been asked to leave my country and leave Uganda because of the color of my skin, and had 90 days to leave. My whole family did. And I was 14 at the time. And in the process, I have learned that, for my whole family, we were all separated in 9 different countries. It took us several years to all get reconnected, and each of us faced many challenges. And we relied on the goodwill of volunteers who helped us to get acclimated into the places that we were living, the countries or the communities that we were living. I was very fortunate. I also had a volunteer who helped me get settled into my school in Toronto, Canada at the time. And, I watched how my family as immigrants who were all educated had to struggle so much with finding jobs, finding healthcare, learning about healthcare, and learning about how to be a good citizen and a contributing member of society by, getting applying the education that you have into the communities and getting a job and paying taxes and surviving. So I think the very fact that the Wyss Center has come into existence from the generosity of somebody who really cares. Just in a city like Philadelphia, 1 in 3 children live in poverty. Many of them are immigrants who live in our region. That is a huge inequity. And that is a gap that I think that the center can fill.
Outside of academics, we are highly dependent on partners and forming partnerships and strong relationships, especially around wellness for our students and our families. That's a large concern. And now more than ever, we're going to be dependent on referring students and families to places like the Wyss Wellness Center. Systems can be very difficult to navigate for our families, and we want to make sure that we're referring them to not just a place, but to the right place. We at Southwark have a philosophy that we're just not going to hand a family a piece of paper and say, okay, goodbye, that we're going to provide step-by-step instructions and directions and support. Just because you hand a piece of paper with an address and a phone number doesn't mean that one of our students is then going to get that next step in terms of what they need. So let's say it's a vaccination or a physical. We've had challenges in terms of providing appropriate referrals. So we established very early on partnerships with Jefferson, and we really cherish those partnerships, whether we're talking about Saturday school programs we did with Jefferson, their School of Pharmacy, which has a wonderful program with our 6th grade, and other things that we've done with them over the years. This continues with that tradition, and we're very appreciative of what they provide for our students, our families, and the general Philadelphia area community.
I met Dr. Altschuler probably about 5 years ago at this point. I think he became aware of the Bach building, perhaps through Ricky Brower and her work at Southwark Elementary across the street. In any case, Mark approached me and to find out if there was any space for a very small primary care office at Bach. So we started looking at spaces that were around 500, 600 square feet or so. And as more and more people at Jefferson got sort of involved in the conversation, that vision grew bigger and bigger over the years until ultimately we landed on this first floor east wing of the building, which is around just shy of 7,000 square feet. I mean, I think it takes a lot of imagination and did take a lot of imagination to envision a medical center in a place like Bach. I mean, it's an old vocational school, so you know, obviously there was training in nursing, for example. However, I think it took some creativity and imagination on all sides to see this center coming to life in an old school. How could the space be utilized? How would the neighborhood access this space? Interestingly, you know, the space that they're in used to be the old nurse's office of the school, which I think is a really interesting, perhaps a coincidence, perhaps not. But yeah, I think it took a good bit of imagination and creativity on both sides. But we're incredibly excited that Jefferson was willing and able to take that leap to see the Wellness Center here at Bach.
Our partnership started all the way back in 2008 between NSC and Jefferson, what was then the soon to be formed Center for Refugee Health. And throughout all of those years, Jefferson has really been a local leader in advancing care for refugee and immigrant populations. And we are so excited that the Wyss Center will be really in the community where so many of our clients live. It's pretty widely recognized that South Philly just has a lack of primary care in general for all populations. There just aren't very many primary care sites there. But I think beyond that, the Wyss Center really provides a hub, a home. We often talk about with newcomers, them finding their medical home, a place where they can feel comfortable with the providers, with the staff, really getting the care that they need. And I think the fact that the Wyss Center will be walkable for so many of our clients, and also be more than just a healthcare institution, really be a place for community meetings and community supports, will be so transformative for our refugee and immigrant communities who really are seeking out those spaces that can be not only a source of formal resource, such as seeing a healthcare provider, but informal resource and opportunities and places to connect and talk with other community members and get information.
It is an honor to participate in the celebration of the opening of the Hansjörg Wyss Wellness Center, which will serve as an extension of Jefferson Center for Refugees Health. This is such an important establishment when we think about what it means to create a culture of health and well-being for these new residents of our city. The Wyss Wellness Center is increasing both access to care and social services, all in a singular location. And we're so excited to be part of something that will surely help make a difference. The center's mission to serve refugees, asylum seekers, and immigrants who are often fleeing difficult circumstances in their home countries is commendable and inspiring, to say the least, and aligns with who we are as a company and a partner in the region. The integrated medical care for underserved populations strongly aligns with Chubb's Foundation's health and wellness purpose, which is primarily aimed at addressing health issues for populations with the greatest need. At Chubb, we have a deep appreciation for the communities we serve, and in this instance remain committed to supporting the efforts to reduce the health disparity gap in Philadelphia's most vulnerable communities and provide medical services regardless of health insurance or citizen status. Through this center, a significant immigrant and refugees population will benefit from access to resources that support their goals for themselves and their families to be healthy and to thrive. Chubb has a long history in this city, and we believe efforts like these are critical to our society and part of our obligation to help ensure we continuously assist in the helping to make a difference in the communities we live and work. Congratulations to all those involved in developing this much needed program, demonstrating what's possible when we work together as a unified society.
Our family's been lucky enough to be friends and know Mark for over 20 years. When Mark was coming out of University of Pennsylvania, he was looking to find an interim job for a year to bridge being able to go to medical school and help with the family's financial resources as they have multiple kids in college at the same time. So we were introduced by a mutual friend, and Mark became our Manny. He helped with our 3 young children and literally changed our life and began a lifelong friendship. During that 1 year, which we ultimately coaxed him into a second year, and then many visits thereafter, our kids grew up really thinking of Mark as a second father. Aileen and I were so lucky, such a warm and caring and giving person. When he got married, our kids were at his wedding and part of it, and we have been so proud of watching his career blossom at Jefferson all these many years later. And I'm not the least bit surprised that he took his passion for giving and caring and help people less fortunate, which is what we're celebrating today. And so it is with great pleasure that Aileen and I are part of the community that wants to give to Jefferson's wonderful initiative, but we did so specifically to honor Mark and what he's meant to our life, to our kids, and the values that he and Jill and their family now possess. And we've been just so proud to be on the journey together. Congratulations, Mark, and a huge personal thanks from the Roberts family.
And it all began when Elizabeth Dale, a longtime friend, introduced us to Mark Altschuler, and we learned about his vision for what is now the Hansjörg Wyss Wellness Center. Hearing his commitment and passion for the refugee and immigrant population and understanding of their unique needs when accessing healthcare, we knew we wanted to be involved. And as you know, Mark is the director of the Jefferson Center for Refugee Health, the largest medical care provider of refugee health care in Philadelphia, serving people from over 60 countries. In fact, Jefferson is one of 4 institutions across the nation identified as the center of excellence in refugee health care by the CDC. And our foundation, committed to improving lives, focuses on understanding on underserved and marginalized populations and attempts to elevate social justice for those whose voices have often not been heard. Now more than ever, we feel it's important to contribute towards projects that demonstrate, particularly to the Southeast Asian population, that America welcomes them, cares for them, and recognizes their value to society. It's amazing to note that data indicates that 60% of immigrants don't know where to turn when sick, particularly if uninsured and lacking citizen status. Let us not forget that we as Americans are all immigrants and our ancestors all refugees, with the exception of our American Indian brothers and sisters. Most of us have family stories of the struggles our family ancestors went through to leave oppression and danger and settle in America, the nation supposedly of opportunity and freedom. In remembering, we believe it is our duty to support efforts that provide the kind of welcoming care and attention we would want if in the same circumstances. This center allows for the expansion of compassionate and culturally competent care to this population. It will provide a type of community home for healing of their minds and souls as well as their bodies. It will also provide a training for Jefferson's physicians and care providers of the future, training them to be sensitive to the challenges and barriers an immigrant and refugee faces, and teaching them to provide culturally competent care. The Scheller Family Foundation is so proud to be one of its supporters.
Yeah, and I always keep in mind the history. You know, a lot of the Southeast Asian immigrants that are here and refugees didn't come as volunteers. They were forced to come. They left Vietnam under terrible circumstances. In South Korea, they are our allies to this day. In fact, I have a close family relative from the Army who got the Silver Star battling with the South Koreans in Korea. And also from the Philippines, I have other family members who welcomed the aid of the Philippine population. And these are our allies. And in today's climate, I don't understand why anybody would threaten or fear our friends and allies from Southeast Asia. Many of them are now members of the United States military, and we cannot forget them. And therefore, I think what Jefferson is doing is extremely important to provide health care for people who certainly need it. And particularly in South Philadelphia, where so many of them have settled. And Jefferson being so important in providing health care nationally and recognized for Southeast Asian population and refugees and immigrants. So we should welcome them and make sure that they feel comfortable and do whatever we can. And that is one of the main reasons why the Scheller Family Foundation wants to and is supporting the Wyss Center and Dr. Altschuler.
I want to welcome you to the Wyss Wellness Center, and I want to just thank you for your generosity in getting this vision started. we just took a tour of the space, and you got to see the community space and the medical space and SEAMAAC's offices. I'm just kind of curious, what are some of your first impressions of the space here?
Well, there are two impressions. The first one is how wonderful the entrance is.
Great.
It wanted me to come right in. I want to see what's going on here, which is so important for the community you serve. And the second thing that excites me is the cooperation between an organization that takes care of the social needs of people, an organization that cares of the medical needs.
Sure.
This is unusual. I haven't met it in many places. And congratulations, because it will make a visit for these people who need help much easier, much less time consuming, much less threatening, because you work from the doctor's area into the social area. So those are the two best impressions. But however, there are many good impressions. And I walked through, I think, a fantastic space to take care of medical needs. I've been in a lot of hospitals while I worked in orthopedics, both in the OR and everything else, and since then I'm usually a patient when I go to hospital. And the exam rooms here are as good as exam rooms in the best hospital I've ever seen.
Well, I'm so thrilled that your impression was so positive. We feel the same way, and Jefferson has been caring for refugees for over 13 years, and we knew that even though we were providing excellent care from a healthcare perspective, we knew that there was a lot of pieces missing. And then we had our partner with SEAMAAC, who's doing all these incredible activities in the community, but the one piece that they didn't have was healthcare. And I think what we have seen over the past number of years is that there are so many barriers for addressing healthcare disparities. And we knew that if we were together and in the community, we could provide the highest level of care for patients who deserve it.
Well, this feels such a terribly important need in America, and a need that for me is very hard to understand. I still don't comprehend why America is not a healthcare system that provides healthcare for everybody when you just walk in. It's incomprehensible. You go to France as a tourist, an American tourist, you have a car accident, they take care of you in a half hour, you don't even get a bill. Every citizen can walk in anywhere in the hospital. And America is supposed to be, whatever the country is supposed to be. It does not provide health care for everybody. And I'm not saying, Medicare for everybody or Medicaid for everybody or anything like that. I just said there needs to be a system where nobody falls through the cracks.
You're right.
And so this helps to fill part of those needs.
Right. And what we also wanted was we wanted a place where the community could come and feel welcome and know that it's as beautiful a space as you would find at some of the top hospitals, because we want people to feel that they deserve the same high level of care as anyone else, regardless of what language they speak, what their income is, what their nationality is. And the exciting thing about our new health center here is that we're able to provide care to individuals regardless of insurance status, regardless of citizenship, and really give them the best care they need, and hopefully try to kind of catch them up on some of the care they haven't had over a number of years due to so many barriers that are out there.
Yeah, I think this is exactly what's needed, and I hope this is the beginning of a couple of more hospitals in the area or in Pennsylvania or in another state. Use this as an example to create some, I could call this almost a community hospital, isn't it? Mm-hmm. In other states or other towns. And maybe the more publicity we can get for this, it entices other people to donate some money or other medical organizations or hospitals to create something similar.
Absolutely. I know
it's badly needed.
Yeah, Jefferson has a collaborative for health equity, and I know that Jefferson is committed to addressing the healthcare disparities. And we need to, I always say that we need to bring healthcare into the community and not always make the community come to healthcare. And we do need more sites like this, but this can't happen without philanthropy to get started. But we know that once we start, we know that it's exactly what the community needs. And if we really want to make an impact on the community and address the disparities that have existed for decades, that you need to start small and hopefully replicate places like this throughout the city and throughout Pennsylvania.
Well, I should probably thank you strongly in the name of the community that you took the initiative to do this. You know,
Thank you.
so in name of the 17,000 people said you're serving SEAMAAC in the name of everybody, they should all thank you. All we did is help you to do it, but we didn't have the idea. You have the enthusiasm, the idea, and I just see I feel the spirit of you in here.
Well,
that's wonderful.
Thank you, but I never like to be the center of attention, and honestly, this is something that I have felt very fortunate to be at Jefferson for many years and to be working with this community. But honestly, this is something that was built through years of discussions with Toy and the leaders at SEAMAAC. We had numerous discussions with the different communities here because we wanted to really hear from them what were the things that they wanted and what were some of the barriers for why they could not get care. It's crazy that a city here that has so many universities, medical centers, medical schools, that so many people don't have access to care. And if they're going to go anywhere, if anywhere at all, they're going to go to an emergency room. And we all know they really just need to have a really good primary care doctor who can provide the services from a healthcare perspective. But also, health is just one piece of someone's wellness, which is why we wanted to call this a wellness center. We knew that all the other aspects that help someone's wellness could be received by SEAMAAC. So thank you for the gratitude. This is really something that I knew we had to partner with SEAMAAC for. We could not have found a better partner that has been doing work in the community for over 30 years.
Fantastic.
And honestly, we're so excited that we can open and be there for the community. And even though we've only been open a week or two, just hearing the feedback from the community when they walk in, they see the bright, welcoming space. And when they come into an exam room, we can meet with them, get them set up for insurance, and offer to take care of their entire family. Just seeing them light up and get so excited has made it worthwhile. So,
well, the word will spread fast through the community, I'm sure.
Good.
It will.
They got to keep us busy.
Yes, that's good.
Yeah.
Well, thank you for such a wonderful visit, and thank you, both you and everybody else who was involved in making this a fantastic space. Thank you for explaining what your organization does, which to me is wonderful. But the best thing is that when we walk down this hallway, that there were exam rooms and there were medical rooms and medical office, and then you come to the social part of the building, which you take care of. And what made you cooperate? Maybe that people would like to know. What opportunity did you see here?
Well, for SEAMAAC in Jefferson, we have always considered whole body health care to be of primary concern. We know that a lot of social factors for those who are poor, those who are immigrants and refugees, who are economically marginalized, have a lot of social factors that impact their physical health. And so when I have had the chance to work with Dr. Oakschuler from Jefferson, I jumped at the chance to dream about what this might be, and then setting that dream into motion. And then we met you, and really putting brick and mortar to the dream. And so having this here is an incredible privilege for me, and to represent a community that has been largely neglected. And it takes philanthropy, as Dr. Oakschuler said.
The dream has come true, and the dream is now out in the community. And I thank you very much.